Hi, everyone. My name is Anna Froling, and I'm president of the Rochester League of Women Voters. Thank you for joining us this evening, and we hope you can join us on October 28th for an event on local redistricting, Rochester and Olmsted County. We're going to focus on. Tonight's topic is age-friendly Olmsted County, an extended effort for regional planning. But first, I want to mention a few items while the audience is joining. This program will be recorded and made available via a link on our website and Facebook page. Our website is lwvrochester.org, where you can join LWV using our online join and renew link. You are welcomed and encouraged to turn on your cameras. To avoid distractions, attendees' microphones will remain muted so we can hear the speakers. We encourage you to open the chat box, the green icon on the bottom of the screen. Participants are encouraged to use that to ask questions, and we will be posting useful information and links there. Now we'll have an introduction to our program, Age-Friendly Olmsted County, an extended effort for regional planning, by our longtime LWV Rochester member, Ray Schmitz, who has been involved in these efforts early on. Ray.
Good evening. My name is Ray Schmitz. I think probably over 3 years ago now, Dave Beal was chairing a meeting involving community members. He asked for volunteers who might be interested in talking about something called age-friendly communities. And Gail and I did volunteer to start coming to some meetings. The group of initial volunteers was relatively large. I suspect probably 30 people. That declined to a fairly steady group of 10 people or less. And we were introduced to the fact that AARP, the Association of Seniors, was the host of a group called Age-Friendly Communities, which was spreading across the United States. There was a state employee, an employee of AARP, who met with us and helped us proceed with the drafting of initial applications. And of course, David was chairing the commission. Initial applications, working with both the city of Rochester and Olmsted County to decide who might be the best sponsor at the community level. And the decision was made, and Olmsted County agreed to work in that capacity. So this has, as I said, proceeded over the last 3+ years. It has come to the point where it is now the process of completing final applications, working through the state to get the total certifications. The group has been meeting for the last several months to talk about what Olmsted County has to offer and what we should be talking with people about. And without further ado, I'll turn it over to Dave.
Thank you, Ray. And Ray, I appreciate the work that you've done. Ray, as he alluded to, has been part of this process from the outset, and has contributed greatly to the work that we've been doing here in Olmsted County. So I do have a slide deck, and Walt, I believe, is going to put that up for us. Thanks, Walt. This evening, I want to talk some about Olmsted, age-friendly Olmsted County, and I'm going to try just to give an overview of this age-friendly initiative, what we have been doing locally, and how the initiative came to Olmsted County. We have issued earlier this summer an initial report, and I will sort of give an overview of that. Something we're doing currently is we're fielding a survey to try to get a read on the community's preferences with regard to the work we're doing. And we'll do a short Zoom survey of a portion of that. And then I'll sort of catch you up on what our current work is and ways you can get involved in some further resources. Take a look at. So let's start with the first slide there, Walt. Or the next one, I guess. We're on the first one. The age-friendly movement is an initiative of the World Health Organization. This is something they began in 2006 in response to two global trends that they were tracking at the time. The first is that we are an aging planet. More and more people are living longer and we're older, just an older planet. And it's something, so far as people can discern in recorded history, something that's never happened before. And the World Health Organization sort of took note of that. And in addition, we are increasingly a much more urban planet. People are congregating more and more in large urban areas. And so they wanted to look at what would it take in an aging world to improve the lives of people who are congregating in these large urban areas. That was the initial sort of plan. Over the years, they've reviewed it, they've refined it. They did a couple of revisions over the past 15 years. The age-friendly city now also encompasses all communities of all sizes, urban and rural. And they've recognized where they were falling short in some places and improved on that. But basically, the work we're doing now has its origins in this World Health Organization effort that began in 2006. The framework they established at that time has remained consistent. There's been some additions, especially recently, but basically it established, the World Health Organization established this sort of framework to kind of look at life in the cities. And they wanted to look at the relationship between the built environment, things like housing, transportation, outdoor spaces and buildings, the social environment, social participation, respect and social inclusion, civic participation and employment, and then the general community and health support with community support and health services and communication and information. And this is sort of their common depiction of that, emphasizing that these, what they call dimensions or domains, are interrelated. And so this is sort of a framework or a filter to looking at local communities and sort of doing an assessment. And we'll be returning to this, the notion of these domains throughout the presentation this evening. Walt, the next slide. Early on in the process, the World Health Organization established in some countries, many countries, what they called affiliates. In the United States, the affiliate organization is AARP, and they basically facilitate, convene, and move this initiative forward within the United States. And so I thought we'd look at their definition of what an age-friendly community is, and it's here on the screen. An age-friendly community is one that is safe and secure, has affordable and appropriate housing and transportation options, offers supportive community features and services. Age-friendly cities and communities are physical, social, and economic urban and rural environments that enable older people with different capacities to age safely in a suitable place, be included and participate, have access to affordable, accessible services, develop personally and professionally, contribute to their communities while retaining their autonomy, dignity, health, and well-being. In other words, it's a good place to get old. And the age-friendly movement really tries to address, though it certainly begins with conversations around older adults. Aging is something that happens the moment we're born. And so it really is an attempt to address and build communities that are appropriate for all ages. I've often said, I don't know if it's a pleasant thing to contemplate or not, but we're not really concerned about cradle to career, but cradle to crypt. So it's a lifespan sort of look at communities and what it means to live in those communities over time. Right, I'm sorry, Walt, the next slide. Since I think it was, I believe it was around 2012 that ARP really began to get some traction on the age-friendly network here in the United States. And when I captured this screen 2 days ago, there were 575 ARP age-friendly members, and membership can operate and occur at various levels. Initially, it was mainly cities, larger cities, then small communities, but often municipalities. Later, counties began to join, and now states are joining. And so you'll hear about age-friendly cities, age-friendly counties, age-friendly states. I have listed here the current age-friendly network members in Minnesota. The cities that are italicized are cities that have completed an action plan. We'll talk more about that. As you can see, the first city to join the network was Minneapolis in 2015. And there have been a flurry of recent members, as you'll notice, beginning in 2020. And Olmsted County submitted an application for membership in early 2020. And we are officially registered as joining on January 7th, 2020. And all of the communities that are listed have these summaries. And as indicated, we're currently in the process of creating an action plan. The reference here to an AARP livability index score is something we'll take a look at. But basically, AARP has come up with a very robust system that aggregates and curates information around those 8 domains and a system of scoring communities at various levels, at state, county, local, neighborhood levels across those 8 domains. And then they sort of aggregate that score at various levels. So the Olmsted County score is 63. That's probably not meaningful in any significant way at this point, but basically that's what that's referring to, and I'll give you a reference for that. The livability index is something that we used in our work as we looked at the application and the work we're doing now. There are plenty of, there is sort of this surge of network growth. The last time I captured this screen was just a few months ago, and around 125 new members have shown up in the meantime. And in Minnesota, there are a variety of communities in the pipeline for joining. I met with some people in Duluth, for example, recently, and every time that we get together with members of the network, we're hearing of more and more communities that are taking a look at joining the network. And as we'll discuss a little bit later on, there's an effort now at the state level for Minnesota to join and become an age-friendly Minnesota member of this network. Next slide, please, Walt. Ray sort of gave you a pretty good history of how we got to where we are. There was I don't know if some of you may have remembered that I think it was around 2012, the state demographer was going around to cities and communities in Minnesota giving a slide presentation that he unfortunately called the silver tsunami. In those days, the demographic shift was seen as a natural disaster. We don't refer to it as a silver tsunami anymore. But basically, what he was drawing our attention to was this growing demographic shift that was in the state, coming in the state, and we're in the midst of it now. And basically talking to communities about trying to get ready for it, taking a look at what the impact of the shift might be. And so there was a beginning of a conversation about this sort of lens as early as 2012. As many of you know, about that same time, something else began to move into the city that sort of captured the civic conversation for a few years and still does. The Destination Medical Center. A lot of our conversation was focusing on that and the impact and implications of that. And during the course of that, the conversations that started around the needs of seniors and older adults kind of slipped away. And so it was around 2017 that some of us said, whatever happened to that conversation? Frankly, I had forgotten it myself. That at one time we were really sort of taking a look at these concerns, and maybe we should again. And so some of you may know of the civic group In the City for Good. It's an unincorporated community organization that basically looks at economic development issues. We began having conversations around bringing that lens back into the conversations that were going on in the community around housing and transportation, all the issues that basically are showing up in the network domains. And as we began to explore a way to move forward, that's when most of us, that's certainly the first time I stumbled across this thing called the age-friendly network. And so we were in conversations with AARP Minnesota, and as Ray mentioned, we invited them down. They gave a presentation to help us understand what this network was about, the kinds of resources they had available. We met with Age-Friendly Northfield, who were about, at that point, a year into their process, and they kind of shared with us what they were doing and how they were organized and how they were proceeding. And so we began our process locally with a group of volunteers, Ray among them, to look at Olmsted County joining the network, or actually our community joining the network. And as Ray suggested, one of our first conversations was, since a government unit needs to submit the application, who should we approach? I remember after one of our In the City for Good forums, I believe it was one where we had some county representatives speaking on various issues. I mentioned it to Commissioner Cascaden that this was something we were looking at doing, and she didn't say no. In fact, I think she kind of thought it was a decent idea, and encouraged us to kind of go forward and talk to staff and begin to explore what this might mean. So as we were doing that, as we were having the conversations with Olmsted County government about applying to the network, and even ourselves learning more about it, we also, at the encouragement of AARP Minnesota, went ahead and did a community assessment, a survey, and some focus groups around these 8 domains to kind of get a read on where Olmsted County was at. And then in January 2020, the Olmsted County Board voted to support network membership, and it asked Family Service Rochester if we would lead the age-friendly planning process, convening and facilitating the planning activities and the preparation for action. And so where we are today is the result of some community volunteers looking at the issues, talking with AARP and in partnership with them, exploring our membership in the network, working with Olmsted County, and Commissioners Cascaden and Wright have been champions of that process. And then as we joined the network, Family Service Rochester, which we provide many services for senior independents and older adults, if we would take on the role of leading this next step. Next slide, Walt. When you join the Age-Friendly Network, it's not a designation. You don't get a sign out city limits or stickers you can put on the window. It's basically committing to a process. And so an age-friendly community is a community that's continually working on being age-friendly. It's laid out as basically a 5-year continuous improvement process, where in the first year you do an assessment and develop an action plan. In the next 3 years, you implement that plan, you evaluate it, and you repeat the process. It's a collective impact model that probably many of you are familiar with. The assessment is essentially a gap analysis. The action plan, it looks at those areas that you think you can have practical impact on, and then to close and work with those gaps. Then you bring on partners that you think can help you implement that plan, evaluate the work that's been done, and then do another assessment and repeat the process. It's very similar, not nearly as comprehensive or as the community health needs assessment and the community health improvement plan, but it's a similar sort of process. And the goal is to constantly look at the data and the evidence to bring on partners who you think can help and determine those areas that seem ripe for action, and then move on those areas. So we're basically, though we've had a kind of a long entering process, we're officially sort of in year 1, where we've completed an assessment and are now moving into the action plan. Next slide, Walt. As I mentioned, we did a community a survey. I think it was in 2019, and then after the county supported the membership and submitted the application and was accepted, we began a broader assessment based upon the survey we had done, and then other available information that we were able to gather from various sources, local planning documents and surveys and research reports, municipal, Rochester, we looked in Rochester, Byron, Stewartville, basically what was available. There's some, the state at that time was conducting its own surveys in pursuit of the age-friendly Minnesota membership. And we looked at some national surveys, mainly from work that had been done by ARP. Basically sort of brought those together and then looked at them in terms of the domains. Next slide, Walt. One of the first things we discovered is what we already knew, but now we could attach some numbers to that, is that older adults, and in this case, that references 55 years or older, are the fastest growing age group in Olmsted County. And as you see here in these pie charts, you see that increase. We're not older adults aren't the majority, but they're an increasing portion of the population, coming from 19% in 2000 to 30% is anticipated in 2025. And then you see the subsequent reduction of the percentage of 18 and under and 18 to 54. We're certainly a county that's a community that reflects the demographic trend that the state demographer was warning us about in 2012. Next slide, Walt. One of the things that we did do, that we wanted to do up front, was we anticipated that things aren't the same all over. And so we wanted to look for a way, and this is reflected in the report, to kind of divide Olmsted County into what seemed to be workable sections where we could try to begin to track how things are manifesting differently. We decided to use this method that was part of the Maxfield study that some of you may know of. It was a housing study that was done late last year, published late last year. And so we began to sort of section out and look at the data that we were examining in terms of these different parts of the county. Next slide, Ray. I'm sorry, Walt. And this is just an example of how that plays out. Even though as a county, we're seeing increases, it's not the same all over. So for example, 30% of the population countywide is anticipated to be 55 or older in 2025. But when you look at just Greater Rochester, that's 40%. When you look at, say, the eastern part of the county, that's 24.5%. And so every issue that we looked at manifests itself somewhat differently in the county, in Rochester, in the outlying area, in the various communities, Byron, Stewartville, Iota, and in the townships. And so we wanted to be mindful of that, and we try to call that out where it's appropriate and useful in the report. So just a reminder, the next slide, Walt. When we looked at the data, and the data that we looked at, the data sources are included in the report, we were trying to get a sense of, in these 8 domains, as they've been laid out by the World Health Organization, what can we find out locally about what it is that seniors and older adults are saying that they want, what services are available, and how are those wants being responded to, and what's the difference between what people believe they need and want locally and what we're able at this point to provide. I've added here, this is a recent version of the 8 domains, and as I mentioned earlier, some of these areas are being, some other areas are being called out And so, for example, now there are focuses on emergency preparedness, elder abuse, public safety, and dementia-friendly communities. And the state in its work is also kind of calling out some areas. Sometimes these are areas that people feel aren't really captured by the domains as they're presented, or areas that within domains that folks believe need to be called out more specifically and given more prominence in conversation. But basically, sometimes we'll now see additional areas added to these domains. So briefly then, in terms of the report, the next slide. The report reflects 9 findings based upon our look at these 8 domains and data sources that we looked at. What we did then for each of the findings is we identified the primary domain that we think that finding references, and then because these domains are assumed to be and indeed are interrelated, we tried to identify what we thought were the prominent secondary domains that were also impacted by the finding. And we do so, we thought these indications not only highlight the interactions, but will also call them to the attention of various stakeholders, agencies, and organizations as they look at these findings. So that people who are concerned with transportation, I think it's pretty readily agreed, also have an interest in housing and vice versa. And so certainly community support and health services and social participation have an impact on housing, and the reverse of that is true. So I won't go through the report in much depth, but Walt, if you'll call up the next slide, I thought we'd take a look at, or share a couple of the initial findings, and then to sort of call your attention to the others. It shouldn't come as a surprise that the report is finding that housing is fundamental and a fundamental and pressing issue that sets the stage for nearly everything else. And that in terms of what we're seeing, affordability has to be a priority immediately and later. We need more senior housing of all kinds. Every report you look at will tell you that people want to remain living in their homes, and that is something that needs to be taken into account as we kind of look at housing, and that all home design should be accessible, so that it's available for people to live in comfortably at all ages, and actually to have people over so that they can move about your home comfortably when they visit. Next slide, Walt. Second area is transportation. It's not surprising that that's also important. The availability of transportation empowers us. Lack of access to that hinders us. There is a great potential for use of public transportation. One of the findings that we did in our survey was that even though older adults aren't prone currently to use public transportation, they have a high opinion of it. And part of the reason for that is we're a society that drives, and that's true of all ages, that can drive legally, and a few maybe they don't. People are willing to walk if the infrastructure for walking and biking is available and supported. And there are new modes of transportation on the scene. Services like Uber or Lyft, they don't tend to be used by older adults, but they provide a potential source to help us address broad transportation issues. Mainly when it comes to transportation, a broad mix of available means of transportation and a way to easily access those means is something that a lot of communities are finding important. And just as housing becomes fundamental, transportation is also a sort of a fundamental domain. Solve those problems and you help people solve a lot of other problems at the same time. So we'll take a brief look at the other ones, Walt, with the next slide. We also found that there's a need, and this is a long-standing need, for people to understand what is currently available. Sometimes you'll get an answer that people are saying that something isn't available, when as you read those responses, you know that they are, so you must conclude that people don't know they're not available. But if you ask people if they're aware of things, there are plenty of services in town in our communities where you'll find out that people aren't say they're not aware of them. So having good information about services of all kinds, amenities across all of the domains is important. Preventable health conditions are impacting our quality of life and the need for services. Prominent among these, especially for an aging population, is falls. And people need to feel safe or want to feel safe where they live. And safety here is not simply an issue of crime, but just how they feel in the neighborhoods in which they live, how welcoming those neighborhoods are, whether they believe they can move safely about in those neighborhoods. Next slide, Walt. Public spaces, buildings and outdoor spaces need to be accessible. Adults are a critical part of the workforce and local economy, not only as members of the workforce, but also as a source of a vital part of the economy. I was in a meeting recently where someone cited that adults 55 and older now control 80% of the net worth of the country. You can take that number anyway, but most people that are looking at the economy know that a lot of the wealth that we have is in the hands of older adults, that there's going to be a great shift of wealth coming as estate and inheritance. We're going to see a great generational kind of shift of wealth as this wealth that's collected among older adults moves to a rising generation. And also we know that we have an aging workforce that is not retiring necessarily, that some workplaces actually have 4 generations present in their workplace. And that can create opportunities and challenges at the same time. Green spaces, trails, parks, and connections to nature. People regard those as not as amenities or extras or nice to have, but as important parts of their communities, and the availability of those is seen as vital. And finally, being able to access services of all kinds and amenities of all kinds is uneven across the county. I think some of the work being done recently around food security is raising that in that area. A grocery store closes, and that can have a great impact on a lot of people. We had that experience in Byron a few years ago, and had some stores closing in Rochester. And when that happens, people lose access to those services. And then a final number that I think is, if there's an overall metric, and this would be the next slide, well, if there's a broad metric that would sort of track the work, is one that came from the Community Health Needs Assessment, which was one of the data sources that we looked at. And in their 2019 report, this is what they reported out, is that when you ask all the residents of Olmsted County if they believe the community promotes senior independence, less than half do, 46%. But when you ask retired residents, and the assumption here is that those are older residents, the same question, 35% believe this. I'm always tempted to go only 35%, because it seems to me that that number is low. Now, clearly, some of that might be that this is a reflection of what people believe, but we all know, I suppose, that that's as important as what actually exists. And that I think if we want to look long term about some a big metric to move, it would be to improve these numbers. That our residents, all of them, and especially retired and older residents, believe that the community is one that supports them and that promotes their ability to live with autonomy and dignity and respect, and to participate fully in the civic life of the communities that we share in Olmsted County. At this point, we're going to just pause a bit, and I just have a few more remarks afterwards. We have, as I mentioned, fielded a survey to try to get a read of where people's preferences are. This slide shows us, gives us some indication of what people believe about the community, and it's part of our work to find out what they think we should do about it. And so we've fielded what we're calling a preference survey to try to get a sense of what people find to be important. And so we're asking people basically based on their own lived experience or professional insights, using these 8 domains as sort of the framework to identify what they believe are the top 3 domains where they think action needs to be taken. I'll give you a link for the complete survey in a moment, but this is the first question on the survey, and we thought it might be interesting to sort of get a read of the people that are here this evening, how they would rank, or how they would order these priorities. So if you want to go ahead and do that, pick your top 3. Well, here we have some results. Is anyone surprised what hit 93%? That's interesting. We just did a very small sample of the stakeholder group. We kind of sent this survey out to them. We had a very, very small response back. But it's interesting that in that group as well, outdoor buildings and spaces didn't register any sort of concern, which is sort of an interesting observation to make. In our report, the only community where there seems to be some concern regarding the availability of this sort of infrastructure was Pine Island. So this may suggest that, well, it certainly suggests that this doesn't raise to a level of concern. Housing in our first kind of test is, it's not surprising that it ranks the way it does. And community support and health services also, this is kind of tracking what we did. Yeah, okay. Thank you, Walt. And we can certainly invite comment on your responses to that when we get to the questions and answers and our discussion. So Walt, I want to move through these last slides quickly in the interest of time. So if you could go to the next slide, then. This is where we're at now. As I said, we've completed the assessment. We issued that report in early June. We've now formed a planning group. We have 2 co-chairs, Alan Hansen, who's retired from IBM, where he had various management responsibilities, and he brings that kind of project management experience to our work. And then April Suter, who I can't tell if she's been able to join us yet or not, who is the Director of Innovation and Collaboration at Family Service Rochester, are serving as our co-chairs. Beginning in late July, we began convening stakeholders to biweekly meetings with the goal of completing an action plan by early, April, by early 2022. And so that's the work we're doing now. Where we're at in that process is what we just did here is to try to determine the priorities for that 3-year implementation phase from 2022 to 2025. The preferences survey is something that we're going to include in those deliberations. And then we anticipate that once those priorities get set, and we think we probably will look to try to highlight 3 to 4 of those, that we'll have groups form around those priorities to draft those sections of the action plan. So what's informing the work is the research that has been done and the ongoing research that is being done in these domains. The professional insights of groups, organizations that work in these areas, and importantly, the lived experience of folks in our communities to the extent that we can capture that. And then finally, where we think we can make, as is always the case when it comes down to what are we going to do, where do we think we can make some progress and have some productive impact in closing some of the gaps that we may be finding. The next slide, Walt. I just want to draw your attention to, I'd mentioned that age-friendly, the state is looking at membership in the age-friendly network. An age-friendly Minnesota Council was established in 2019 by executive order of the governor to begin the work. The membership of that council is listed there at several state departments and then 6 stakeholders appointed by the governor. The council, as I said, is pursuing network membership for the state. It has a goal of trying to align state agency to age-friendly policies. In the last legislative session, and frankly, much to the surprise of the council, the state allocated $3.9 million to the work. Of that, $2.9 million is being set aside. It is intended to provide local community grants. Council is working on that at the moment, but basically where they're at is they're going to have 2 categories of grants: technical assistant grants to help communities ramp up and stand up age-friendly initiatives, and then grants that help communities with projects that implement their action plan. And there's the website if you want to check into it. The next slide. I've mentioned the livability index. It's available online. There's the where you can access it. You can, as you can see up there, you can enter your zip code, the state, the city, your address, and get the livability index scores for that area. Those are the areas that they are tracking. They align with the 8 domains. They don't exactly match them, but they align with them. And there's a wealth of information here. They sort of curate and aggregate information from a lot of census data. They look at policies. It's a very robust system created by the American AARP's Public Policy Institute. And with the new census being completed, it'll be subject to some updates. But it's a very good way to explore, and it's a tool that we've made use of. The next slide, Walt. Also, once again, that the assessment report's available online at the Family Service Rochester website, and there's how you access it there. This will take you to our age-friendly Olmsted County page that's on our website, and you'll see a link there to download this report. Slide. If you're interested in more information, you'd like to participate, you want to be part of the process, we certainly hope you will do so and encourage you to do so. And there's my contact information. I do marketing and communication at Family Service Rochester, but I also serve as the age-friendly Olmsted County coordinator. We have an email dedicated to that, and that's the phone number. And then finally, I want to, as I said, this is the link. And Walt has said that these links are going to be on your website, but this is the link to the full survey. What we did was the first question where we're asking people to select 3 of the 8 domains for emphasis. The next question asks you to rank those choices. As I mentioned, you'll have an opportunity to explain your selection and why it is you ranked and selected the domains as you did. You can also, we're seeing, identify areas of concern that you think might have been overlooked by that domain framework. Or if you think there are specific concerns that fall within the current domains that you would like to see called out and attention paid to, you have an opportunity to do that as well. And because we want to sort of understand how these issues and concerns are distributed across the county, you're asked to indicate where you reside. And I encourage you and hope that you'll take the survey and share it, and we can get as much input on that as possible. Thank you.
My name is Walt Rothwell. I'm a member of the League of Women Voters Board. I want to thank Dave. That was a great introduction to the effort. And I think we're going to be joined, yes, by one of your colleagues.
Yes, joining us, April couldn't make it at the beginning of the meeting. I don't think I'll share what she had, but she had,
my haircut.
She had a haircut. She had a haircut appointment. But she's joining us now. April and I have known each other for a long time. I came to United Way. I came to Olmsted County at Rochester to work at United Way, and April was already there, and we worked there for several years. And now we're We have both landed at Family Service Rochester. Many of you, I'm sure, know April and her work in the community. And I can tell you that she's a pretty busy person for a lot of reasons, but she agreed to take on the co-chair position for this next phase. And there are a few people in the county better suited for that job. So I appreciate April joining the effort. She's obviously been supportive of it, and because FSR has been involved, is familiar with it. And the work that she leads at the Family Service Rochester and Senior Independence certainly informs our effort in age-friendly Olmsted County. So, welcome, April.
Thank you.
Do you have anything that you wanted to, any comments you wanted to make? Yeah, Alan Hansen couldn't join us, our other co-chair. Alan is a member of Choral Arts and had Choral Arts business today.
So our plan for the rest of the program, I'm going to facilitate a little discussion and pose the questions that have come up so far. I know that we have some government officials participating tonight. We are going to have two of the county commissioners comment shortly as soon as we finish the Q&A portion. And if there are other government officials that would like an opportunity to comment, if you can just post a note in chat, we're happy to give you a chance to do that. And the first question that I have for either of you is, could you tell us a little bit more about Family Services Rochester and how this project fits into your community mission?
Sure, I'll take that. So Family Service Rochester was formed in 1965 from a community needs assessment. There was one of the gaps that were identified was mental health and counseling services. So that's where we had our early beginnings. And within a year of starting our work, Meals on Wheels was organized in partnership with others in the community, and services that were going to help people, older people remain living in their homes. And so from very early on, Family Service Rochester has been delivering services for older people and people with disabilities that allow them to remain living in the community and as independently as possible for as long as they would like. The work around age-friendly Olmsted County and age-friendly anything really is hand in glove with what we do at Family Service Rochester. Because if our community has a lens around which they make policy, around which they plan, which they execute services, and the like, then people will be able to age in place or age where they like. And most people want to remain living in homes and the neighborhoods that they know and love. And so if those homes and those neighborhoods are age friendly, we're going to help everybody stay where they want to be for as long as they can. And to be sharing this really fits with my work and my passion as well.
Now, I'll confess that I'm a senior citizen and I'm engaged in the related issues. However, I believe that this project is not exclusive to senior issues, and it's my impression that we expect that there'll be some cross-pollination, changes for seniors also benefit other age groups, but based on your familiarity with the community, do you share that view?
Yes, I think some decades earlier, the movement around making buildings and communities accessible for people with disabilities not only helped people with disabilities be able to have barrier-free and better access. It helped everybody. And I think this age-friendly movement is cut out of the same ilk. It's what's good for one is going to benefit most everybody in the community.
Now, do either of you want to comment on, based on the community participation that you've had so far, what do you think this project needs to succeed, both from stakeholders and from government officials?
I think what will benefit in terms of the community at large. I think we need and want and encourage broad participation. I think the professional participation of organizations that operate in these spaces that work around age-friendly and those domains kind of aligned with their missions. And there are plenty of organizations already that deal with the concerns of older adults. By the way, I would just say, well, one way to think of age-friendly is to think of age as a verb and not as an adjective or a noun. That age-friendly communities are communities where people where aging is like I said, planning for lifespans is important. It's clear one of the reasons why the World Health Organization, when they set up the initiative, wanted membership to come through a government unit, was that they believe that it's at that level where policies are made that have the greatest impact, and they believe that those government units, to some extent, and we can talk about how this may be true in various communities, but to some extent reflect the preferences and because of those communities, and so that they find themselves in leadership roles. But one of the things you'll find as you look across the network, and this is true in the state, is that even though government units sponsor membership, they're not necessarily always where that activity resides. So, for example, in Olmsted County, the activity is supported by Olmsted County government, but the activity it resides right now within a nonprofit. And that's true in about 13%. Last number I heard, 13% of the membership of the network resides in nonprofits. In some communities, a local university or social work department takes it up. It's about only 27% of network members have the initiative housed within a unit of government. I think what happens in communities around the relationship between public and private efforts is something that the communities sort out in terms of what works for them and is appropriate for them. Certainly, we're going to need and welcome the support of county government, municipal government, state government in the efforts. But I think in our effort, those governments are going to decide, those government units will decide the kind of participation that's appropriate for them. So, and I think those will be, that in large part will be driven by where the priorities land and the kind of work and resources that governments are committing to those areas that we can harness and participate and influence and advocate for. So, and certainly we've got some representatives here to address that too. I do want to say, since I noticed that Representative Liebling is in the room, and I was said that we were surprised at the amount that the state allocated, when it was considerably more generous than what people had hoped for. So it wasn't a surprise that the state was interested. It was a surprise that the state was as interested as it is. So.
And I do have a question relating to that. So you mentioned the 2.9 million available for grants. I looked today from what I could find on the website. I don't see any specific criteria published yet. There was a reference to mini grants, but do you have an idea at this stage whether it's likely that the project would apply for a grant, or is it more likely that it would be some government unit?
I think it could come from any. I don't know this was a conversation they're having, but I don't believe it'll be limited to government units. I'm fairly certain of that. Since it's well known in the state that not all of these enterprises, these efforts are housed within government. I mean, to the extent that they're sponsored by, I suppose that's the case. And also those project grants won't be limited to, the technical grants are intended to support the development of age-friendly efforts in communities. The grants aren't going to be limited to members of the age-friendly network. That council is currently involved in hiring an executive director. And the last I looked at their schedule, they were going to begin to take applications and sort of sort that process out second quarter next year, with applications decided in the summer and
Right,
the funding
yeah,
become
the
available.
RFP is supposed to be out in the spring.
Yeah.
And so that will help define who can apply and project parameters and all that. So without that, it's really difficult to say.
But based on what we know so far, it's possible that a grant proposal might come from any portion of this project. So people should feel free to brainstorm, right?
Oh, yeah.
Correct.
Okay. Now, if stakeholders or departments want to engage, Dave, you provided the phone number and the email address. Those are the best ways to reach out.
Yeah, I think so.
Okay. Okay.
Let me add something too, real quick, around your question with regard to the role of government here. And we're trying to make a distinction now, because when we say age-friendly Olmsted County, we're really talking about the geographical location, and not necessarily, it's not always like a reference. That's why in my presentation I said Olmsted County government, because sometimes those references might get confused. But it was the support of the county that allowed us to begin this initiative, and the county sees its role as providing us with the data and that kind of support that we need in our planning and assessment. So.
All right, thanks very much. I want to move on to our next segment. And as a transition, I'm going to take just a moment to show you our league website so that people know how they can drive to the information that we've been referring to. So I'm just briefly going to share this. You should be seeing our League of Women Voters home screen. You see right here, lwvrochester.org is the way you drive to it. On the home page, we do have upcoming events, and be aware that on October 28th, we'll have an event relating to redistricting, which is a very hot topic, and there are a couple of judicial entries prior that relate to that. And we have other, election-related resources available there. We have an events calendar, an archive of prior programs, and this recording will be posted there. So if you want to refer other people to view it. But I want to draw attention to this civic issues and resources page. If I click on that, the upper portion is devoted to redistricting. But if you click this down arrow under livable communities, you will find the links that Dave was referring to relating to the county's effort, AARP's resources, and the state resources. So that is one way that you folks would be able to drive to the content if you'd like to review it further. So I want to thank Dave and April for that great summary, and I'd like to introduce our two county commissioners who've joined us tonight. Greg Wright has served on the county board since 2017, and his term extends to 2024. And Sheila Cascaden has served on the board since 2013, and her term will expire next year. I had attended a league event in the fall, get to know your government, and they had a great presentation by the county. But when I look at what the county commissioners do, each one has a list of about 20 different groups that they're affiliated with, and it's amazing how demanding your roles are. So we thank you very much for your service. But I'd like to invite I'd like to invite Greg to go ahead and speak to us for a few minutes about his experience with the program.
Yeah, well, thank you very much, Walt. And thank Dave for his leadership on this. Dave and I met quite early on, I don't know, 2-3 years ago. But he's really the energy behind the AFOC committee work and getting it organized. My initial involvement really started, I would guess, with social studies, because I'd watched these demographics change over the years. And we talked about it in the classroom, and we talked about with kids about the demographic changes and what was coming. And although we all knew what was coming, we just thought things would remain the same, apparently. But now that we know that we have about 1/3 of the population 55 years of age and older, and we have more 80-year-olds than ever before, and now they're even adding another category of the 95 years age and older into our demographics. So we know that we're getting older. And in the past, it's kind of like building a house. When you built your house when you were maybe 30 years older, you didn't think about how you're going to navigate your own house when you're 80. And now when you're older, you think, gee, maybe I should put in some handrails. Maybe I should put in some non-slip flooring. Maybe I should take the ping pong table out and put in a craft table. And that's kind of what we're looking at for age-friendly communities, age-friendly counties. We're saying maybe the things that we had that we planned in the 60s and 70s aren't serving our population now, and what is it that we need so that all the community people, regardless of the age, can participate. And maybe we have a great park system, but I can't walk to it. So maybe I ought to think about how I could get there. Or maybe I should think of a different kind of a park system that's on the boulevard 3 blocks away from me rather than a mile away from me, because I'm not going to play baseball anymore, but I would like a park bench. Those kinds of things is what we really are talking about. I have no preconceived ideas. I mean, I have a personal opinion about what I think that we ought to do, but I have no preconceived ideas of what the committee should come up with. And really, I'm waiting for the FOC committee to do their surveys, put it into a understandable system so that then you can take it to the government agencies and you can say, this is what our committee came up with. This is what the people of Olmsted County came up with. And this is what they would kind of like to see. How might you be able to do this? And then the government agencies have to decide which parts of that they can do something about, where they could work it into the budget, how it fits into the overall plan of the county. But if you don't give us that information, then we can't include it. And I think a lot of this information will come into the community health assessment as well, which we do every 5 years and we need to upgrade. And so this is a great opportunity then for AFOC to have input into that information when the community health assessment is put up. And I want to also extend my appreciation to Commissioner Cascaden, because without her help, it was difficult to navigate this through the county for people to understand that this is going to be community-led. There weren't strings attached, those kinds of things. And the county has contributed very little to this other than to sponsor the agency, which was critical, of course. But without her help, we probably wouldn't have gotten this far either. So Sheila, go ahead and you can give your comments.
Well, Greg, thank you. That was really nice of you. Many of you know me. I'm Sheila Cascaden. I've been involved with Olmsted County's human services systems since the 1970s. So I am definitely one of the aging Olmsted County residents. And I think Greg and your data points out that, you know, we have been known for a long time that our population was aging. Some good news is we are aging in better health than the previous generations did. And so we can look to having active lifestyles for much longer. And so as we deal with our workforce shortage, for instance, increasingly we're looking to seniors to come back with maybe a more flexible schedule to be able to fill out workforce and to do all sorts of volunteer activities in our community. So being older doesn't necessarily mean that you're not active and have a lot of potential contributions to the community. I think the work that you're doing, I was really pleased to hear Dave talk about it as a collective action approach, because that's really what it is. It's really like looking at our community and saying, what are our aims for aging in place and having an age-friendly community? And what are the various ways that different actors in the community contribute to it? So for instance, one of your pillars is the built environment. Well, Olmsted County, we focus more on the human service side. We have a few parks and things, but the built environment, that's the city of Rochester and all the small cities in our town, in our county, that look at, do we have sidewalks? Do we have access? Do we have safety for pedestrians to cross? You know, what are the safety sides? That built environment is a big part of cities' work. But also, I want to just call out that our public health department, and we're all into public health these days about pandemics and disease prevention and so on. But really, fundamentally, public health is asks how do we keep a whole population healthy? And aging in an age-friendly community keeps their elders healthy as long as possible. We all are going to get to the end stage of life sometime, but you want that to be delayed and you want people to be healthy. So Dave referenced the community health needs assessment. That's part of it. But also what are we doing to prevent falls? We had a brief presentation just recently at our Human Services Committee about what our public health folks are doing to prevent falls, which is we heard from recently the county, the medical examiner, that falls are one of the leading causes of deaths, particularly for our older population. So how do we prevent falls? By good health, good balance, good exercise. So this is a public health, community health focus. How do you age in place in a way that is that allows you to have optimal health and be a contributing member of our community, whether it's as a volunteer, the workforce, as a grandparent, or as a friend who supports somebody else as they need help. This is I liked April's reference to what is called the curb cut effect. When we put in the curb cuts on our sidewalks around the country, because it was a part of the American with Disabilities Act. Oh, guess what? It wasn't only the people who were in wheelchairs or who need to use assistance for walking, whether that's a scooter or canes, but it was also the moms with strollers and the bike riders and you and I. It's easier to just walk down that curb cut than go up the curb. So what are the things as we look to aging in place that we can keep that really has benefits to all? So I'm just going to conclude with one more thing. This group said housing is our #1 issue. And I want you to know that the Maxfield study on housing that we completed last year with the city, the county, the area foundation, the DMC, housing, active senior housing was one of the top 5 things that our community needs. We need more supply of housing for seniors. And those are seniors who aren't necessarily needing services and Meals on Wheels, but people like you, several of us on this call, myself included, but I want a different kind of housing. But I don't necessarily want to have a big mortgage to get that housing. Housing costs have gone way up. So what can we be doing? We have had a design process underway Hopefully that report will be coming in soon with a group of seniors, different kinds of seniors, asking what do they need in terms of housing, so that we can go to the developers and say, look, we have a market analysis now. You don't have to worry about building too small of a house, for instance. Seniors will buy this kind of house, and you don't have to worry about the risk of building active senior housing, because that's one of the barriers is builders don't want to build things unless they know there is a market for it. And now we've gone to our own seniors and said, what is it that you want for active living in the community? So that's ways that the Area Foundation carried that work forward. So they've got a piece of the housing question. The county is looking at building a housing unit for seniors who need services. That's a piece. The county would have a piece. The built environment, the city has a piece, and certainly our long reliance on Family Service Rochester and the Elder Network and other direct service providers are a piece, as well as our public health department. So this is going to take community engagement to create the kind of community where we can all age in place and be well and have a good environment, whether we're 45, 55, 75, or 95. So I guess that's what I would say about it, is kudos to the work you've done. And it's really nice to hear you talking about collective impact, about you talking about the way that we will work together across sectors to make this a reality for our community.
I really want to thank both commissioners for your service to the community, for your activism on this issue, and for your time tonight. It was really, really helpful to have you both here. I understand that Representative Tina Liebling is with us and might want to speak to the issue.
So, well, good evening, everybody. First of all, I'm so excited by what I've heard, and just thank you, everybody who's spoken, for your fantastic work. I mean, here, it's really pretty exciting. You know, just this evening, I was at a reception with a trade delegation from Spain. And one of the things they said that really struck me was that their population, 60% of their population is over the age of 65. That's just astonishing. And, you know, it just makes you think about so many things. A lot of them have been discussed here tonight. There was a question that Dave raised about the extra money that came to this effort that was unexpected. And, you know, a lot of what happened in this year's funding bills had to do with the ARP money from Congress that came, and it was the timing of when that money became available and how much of that the legislature was going to be able to allocate. So, and what the restrictions were around that money. So it actually turned out this was an extremely unusual year where we had to sort of scramble to quickly allocate lots and lots of money, which strangely enough is about as hard as figuring out how to not spend money. So, you know, this was one of those, I think that if I recall correctly, I think that's one of the reasons why we were able to do this, because, you know, it fit the definition of what we could spend certain funding on. And so, I mean, that was a really great opportunity, and I hope it's going to give us a huge boost in this area. I just would say too, a couple thoughts I wanted to add. This is so important, as many of you have said, not just for older people. You know, it isn't just, okay, our generation had everything and now we want more and it should all be about us. No, this has to be about everybody. And a couple additional sort of reasons for that. One, I find often people come to Rochester because they want to be near their family. And you know, one of the things that the Spanish people I was talking to told me about how Spain has kind of made it through some pretty bad economic crises is because they have great social cohesion in their families. Families support each other. People who lose jobs can go home and live with mom and dad who might be elderly. Elderly parents can take care of grandparents when there's a crisis. You know, those kinds of mutual supports, or younger people can help you know, when mom breaks her hip or whatever it is. So that is so important that we have a community that says we're here for everybody, because then it lets everybody be there for each other. So that's one thing. And also right now, we know the workforce issue is so huge. And I think Sheila was talking about this, you know, to the degree that older people can continue in jobs or can pick up those volunteer shifts. That's like super important for our economy right now, where businesses are just scrambling. We just don't know where this is headed with trying to find people to work. But we know there are lots of older people who want to be relevant, want to stay in the game, and this effort is just helping with that. So I'll be quiet and just want to really tell you how excited I am to hear this conversation, and thank you all for your great ongoing work in this area.
Well, thank you so much for chiming in, and thank you for your service. So that wraps up our program for tonight. I want to thank Dave Beal and April Suter and their colleagues on AFOC and at Family Service Rochester. I really appreciate your efforts and being with us tonight. I hope that everybody will take a look at our website and follow the events there and the issues of civic engagement, and that you'll join us in a variety of ways. And don't forget the October event on redistricting on October 28th. Which is posted there on the website. Redistricting is going to be a very active issue over the next 6 months or so, and we'd love to have you engage with us to address it. So thank you all. And
Walt, can I just thank you all for the opportunity tonight, and Walt, for your work and making this possible and setting it up. I would share that Walt's already it's already participating in this effort and is been part of the planning group, and we appreciate his contribution too. I'll make one last pitch for you all to get involved when you see the opportunity to do so in the way you think best suits your interests and how you view the community. So thanks again, and hope to see you soon.
good night, everyone.